Hello, I'm Diane Worth, and I want to welcome you back to the second day of the webinar, Rethinking Malaria in the Context of COVID-19. As I mentioned yesterday, we have a large number of registrants for this webinar, over 1,700. We welcome all of you to this global discussion. As I mentioned yesterday, we are co-sponsoring this event with many research institutions and universities, many in the global South, and we welcome and thank all of our co-sponsors. You can find reference to those on the rethinkingmalaria.org website. So we'll get started right away today with the program. Just to recap some of the lessons from day one, the speakers and panelists highlighted the importance of communities, that malaria is a societal problem, not just a medical problem. There's the need for integration with health systems while keeping an emphasis on malaria. There was a lot of discussion of data, but useful data and useful for decision-making at the different levels of the healthcare system. I also think that we should remember, although we heard a lot of challenges yesterday, there have been many successes. In the September 1st webinar, we heard about China, who's recently been certified malaria-free by the WHO, going from 30 million cases to 0. Sri Lanka, El Salvador, all demonstrating what can be accomplished, and that the possibility of eliminating malaria and the world becoming malaria-free is before us. I should also mention that while we're focusing on the challenges in Africa, there are over 40 countries in the world that have fewer than 10,000 cases of malaria. And many of the lessons in the Rethinking Malaria discussion and consultancy are applicable also in these contexts. So I think there's great reason to hope that we will make progress and that we are at an important pivotal point in 2021. So let me call upon my co-chair for this session, Professor Specioso Wandira, the former Vice President of Uganda, who is also co-chair of the governance working group, to describe some of the efforts that she has undertaken in Uganda since starting thinking about since starting the Rethinking Malaria effort. That is to turn words into action. So Specioso, please, over to you.
Thank you, Diane. Again, welcome back to all of you. It's been a pleasure talking and rethinking together. Like Diane said, yesterday we had a robust discussion on issues of governance, on issues of data, on issues of colonization, which is really affected our minds, especially in Africa. We are discussing malaria in the context of COVID-19. Our responses to COVID-19 have been informed by what happened in the Western world as opposed to China, where it was first reported. A prepared health system to the West majorly means hospital capacity, whereas in China, it meant stop the infection, stop the spread of the infection, and we had the strictest quarantine we have ever seen. In the global South, specifically in Africa, and I want to talk in particular about my own country, we started modeling our response in accordance with what was happening in the West. Ventilators, ambulances, beds, etc. Even when quarantine worked, we have not put in enough effort to capacitate communities to take charge. Now, at the September 1st, 2021 webinar, we were privileged to have President Museveni on one of our panels. The president said he would wage war on the mosquito and the plasmodium, but before making plans, he said, I want to look at the figures. Suppose we eliminated malaria and got to zero transmission, how much would we save? What have we done since then? Of course, the malaria teams got into action. The whole country got excited, and many people wanted to start discussion. And I said, too many cooks spoil the soup. Let's get organized. So we put in place an inception team, which has been brainstorming. And it is majorly composed of the Ministry of Health with the Commissioner Planning and her team, the Malaria Control Program under the leadership of the colleague who has already presented here, Dr. Jimmy Opigo, the Malaria Consortium, the World Health Organization is represented on that team, Makerere University with Rhoda here, who will also present later on. And we also inducted a community health non-governmental organization, which is already doing an array of activities in line with what we think we should be doing. What was our task? To answer the president's question. Now, we started off by saying, since the president wants to wage war against malaria and the plasmodium, we shall incorporate military techniques to generate momentum and impact as quickly as possible. So what do we plan to do? We know the usual. Bed nets, spraying, larviciding, all the gamut that we have been using before. But we also agreed that we are going to really put up front treatment as prevention, in that we are going to look for all those who are infected and also do a lot of surveillance, both before, during the elimination, the intensive elimination exercise, and also afterwards to stop resurgence. Now, all this is old stuff, except for the military approach. We are here now saying, have we really answered the president's question? And we haven't. This question cannot be answered by the team that we have in place, composed of epidemiologists, health economists. We need other expertise, financing experts, development economists, ecologists, social scientists, gender experts, agriculturists, community development experts, and we need the communities to be with us as we move forward to say, Your Excellency, this is what you would say, and this is how we need to do it. Now, when you look at the list of all these experts, the only place you can find them in the same space at the same time is the universities. So we are saying we have a golden opportunity to now have policy linked directly with centers of excellence, with our university, Makerere University, to make sure that not only do the experts work on this, but we also get the students, the undergraduates, the master's students, the PhD and doctoral students from across all sectors to start knowing that my degree is going to help the people. It is going to ensure that working as a team, we can actually eliminate malaria. The outcome of this webinar will certainly be useful to help us move forward. So time spent planning is never time wasted. We have a local proverb which says, which means that when you don't plan, you keep shuffling up and down. So we are not taking this urgently because the president also made the same commitment on the World Malaria Day, and we didn't move accordingly. Time spent planning is never wasted. Let us rethink, continue rethinking on how to actually eliminate malaria. It is possible. The people to do it are available, and the centers of excellence are challenged at this moment to really help us fill in the gaps, and we get the answers to the president's question so that Uganda can start moving forward to eliminate malaria. I turn you over to Diane to introduce the next, the first panel for today.
Thank you very much, Specioso. And I just want to call for a moment on Rose Lakey, who is, as you know, Professor Emeritus in the Cameroon. Rose is the chair of the Outside Advisory Committee for Rethinking Malaria, and she is co-chair with Dean Michelle Williams of the Defeating Malaria Initiative at Harvard. Rose, just some greetings and quick thoughts from you, and then we'll move to the first panel. Thank you.
Thank you very much, Diane. And I'm really pleased to be here. Good morning, good afternoon, good evening to everyone on this webinar. So glad to have you here. I just want to take a minute and just remind us why we are rethinking malaria, why this is necessary, and then the approach, just those 2 points. We know that the urgency of the global pandemic has highlighted the need for the malaria community to rethink its strategy and then critically look at the ways we've been doing things. And we know that we're not on track to achieve those ambitious goals that were set out in the global technical strategy for malaria. Progress has stalled. We need a course correction. Rethinking, as we know now, is really necessary. We still have, 220 million cases of malaria today, 435,000 deaths worldwide, the same that we had in 2015. So we're not moving on. And of course, Africa does suffer 90% of this malaria burden. You know, we have on the continent, we've accepted to live with malaria, normalized it. So rethinking is really necessary to assure us that we can eliminate malaria. And then we have COVID-19, it came in, and this opportunity to rethink our strategy. What has it done? It has brought about the fastest vaccine diagnostics that we've ever had, quickly new, powerfully effective tools and treatments to bear on public health challenges. This is exactly what is needed to end malaria. So then lessons learned from COVID-19 really are helping us to rethink malaria. And then the process that the rethinking malaria has been is listening, learning from those on the front lines of malaria control, especially those individuals working in Africa, where the majority of malaria cases and deaths occur. So there has been this global consultation organized across the 3 working groups, as you've heard: malaria governance, integrated service delivery for malaria, training and capacity building, and each working group setting out to offer specific recommendations. And these papers now are out for everyone to read. So these discussions with you all and the general public should now enable us to commit to continuing this rethinking malaria conversation. To do that with colleagues working across sectors and disciplines, with those in leadership positions, in our communities, with our communities, to continue to discuss. You know, my vocabulary was enriched yesterday. Community organized malaria elimination. Good. Decolonizing malaria. So we're here then today, as was yesterday, to further interact on governance and on training and capacity building. So let's delve into the session and find out what the game-changing strategies could be, as we did yesterday. Thank you very much, Diane. And let's get into the session. Thank you.
Great. Thanks, Rose. Thanks, Specioso.